Touliatos, his nickname is Dr. Testosterone. And this is the best presentation that guy can do.
Okay, grazie Massimo. So I will speak about the testosterone replacement therapy in men. So as we age, our hormonal profile corresponds to the progress of aging. Testosterone, DHT, and DHEA, the main androgens in men, declined. Now, as we age, the SHBG protein elevates. This is perhaps related to the sarcopenia and the muscle wasting in men. And as SHBG elevates, the bioidentical free testosterone also lowers. So free testosterone and SHBG are reversely related. And the 98% of the testosterone is non-active because it's bound with SHBG. The active testosterone is the free testosterone, which is the 2%, and this is the bioavailable. So when we measure testosterone, we should check out mostly the free testosterone. So the characteristics of the andropause are low sex drive, low libido, erectile dysfunction, which is not a good blood flow to the penis, muscle wasting, cachexia, sarcopenia, that lowers the basic metabolic rate, so the less BMI, the less BMR. As a result of this, more visceral fat that will increase the estrogen, which is also inhibitory for testosterone production in the brain. Lower testosterone makes less self-esteem, more depression because the DHT is low, and less cognitive function, this foggy mind. And also, the muscle wasting leads to osteopenia and osteoporosis. So in other words, low testosterone is associated with high mortality rate and increased risk of premature death, cardiovascular disease, diabetes 2, Alzheimer, depression, bone fracture, poor muscle coordinator, muscle weakness, and fragility. So testosterone is antidepressive. As a matter of fact, when you take in SSRIs, you can stop them if you're into testosterone replacement therapy. Testosterone releases DHT, which is antidepressive, and we understand this by castrated men in prostate cancer that develop depression when their testicles are removed. Also, testosterone optimizes neurotransmitters, serotonin and dopamine. Serotonin is linked to the joy hormone, while dopamine gives you the feeling of reward. Moreover, estrogens are also related to euphoria and serotonin. So when a patient is using SSRIs, that also leads to prolactinemia and lower testosterone. He develops lower testosterone, and in case he receives TRT, then in the short term, he improves his mood, and as a result, he can lower the SSRI's dose. In the near future, the psychiatric evaluation would require HPTA and testosterone assessment based on a lab work. The same happens with urologists. You go to the urologist because you have erectile dysfunction, and they give you the 5-phosphatidylase inhibitors like tadalafil or sildenafil. But they don't treat the problem from where it starts, which is the low libido, and the low libido is linked with low testosterone. And as a matter of fact, testosterone improves also blood flow through the nitric oxide. So you want to have sex, but also you have better erection.
I bet.
Now, what causes low testosterone? It could be testicular trauma. It could be chromosomal abnormalities, Klinefelter syndrome, which is primary hypogonadism. It could be cortisolemia, chronic insomnia. It could be also diseases relating to obesity, metabolic syndrome, low thyroid function, and medications like opiates, barbiturates, SSRIs, aldosterone inhibitors like the diuretic spironolactone, corticosteroids like cortisone, and narcotics.
Active one.
The use of testosterone is the epitome of anti-aging and the basis of the HRT in men. Now, the benefits of testosterone is better muscle mass, strength, and endurance, better BMI, and better basal metabolic rate. The increase in endurance comes from EPO, that increases also red blood cells, hemoglobin, and hematocrit. It's better oxygenation to the tissues. Also, you have better reuptake of calcium in the kidneys, and then through the presence of vitamin D3, you have better bone mineral density, and you fight osteoporosis. You have better blood flow through the nitric oxide production. You have better insulin sensitivity because testosterone burns the visceral fat, and also as you build muscle, it also burns calories. So you can fight also diabetes with testosterone. Also, you have improved self-confidence, better mood, energy, cognitive function, quality of life. So as I said, testosterone can fight several diseases like depression, diabetes, anemia, fatigue. And this is part, of course, of the anti-aging. This is the tissues where testosterone acts, in the brain, in the muscle, in the kidneys, in the bone marrow, in the liver, in the skin, and also in the puberty to the male sexual organs. Good. Now, what blood work do we need for evaluation of the hypogonadism? Total testosterone, free testosterone, LH, the estradiol, the prolactin, and the SHBG. This blood test should be done in the morning fasted state. Now, the primary hypogonadism is usually characterized by normal or elevated LH because the brain tries to kick up the testicles that have testicular failure and total and free testosterone are low. And we have also the secondary hypogonadism where low the gonadotropins, LH and FSH, and low also total and free testosterone. And there's another part of hypogonadism, the late onset, that bodybuilders face when they use anabolic steroids, and gradually they go from primary to secondary hypogonadism, and eventually they need testosterone replacement therapy. Now, what about the estrogens? Because it's a conflict subject. Aging and sarcopenia can increase estrogens through the visceral fat, obesity as well. Excessive drinking of alcohol also aromatizes in the liver. Zinc, which is anti-aromatase activity, the zinc deficiency. Taking too much DHEA can increase estrone, which is a bad estrogen. And eating soy, which contains phytoestrogens. Now, the significance of estrogen in TRT, we shouldn't block estrogen necessarily. We need to have optimization and balance of hormones. But the reason why testosterone is so important because it produces DHT and estradiol. Estradiol is protective to the endothelium. If you abuse aromatase inhibitor, you disrupt the endothelium and you crash the HDL. Estrogens are also neuroprotective in the brain. If you crash estrogens, like in bodybuilding, you feel very bad. Estrogens support also optimal sex drive. If you kill the estradiol in bodybuilding by the aromatase inhibitors, you don't have sex drive. And estrogens also, we know, both in men and women, support the bone health. In the absence of estrogen, women develop osteoporosis. So we should use very cautiously the aromatase inhibitors and only under symptoms, okay? Now, what are the delivery systems? We have the testosterone injections, either intramuscular or subcutaneous. Well, subcutaneous is not so official, but the reason it was developed is to avoid the deep scar tissue into the muscle. The point is you cannot use subcutaneous a large amount because you will create a lump under the skin. And also because the fat tissue doesn't have that good blood supply, is not absorbed as fast as into the muscle. Now, the slow-release testosterone is the N-of-ATCP-N8, but also we have even slower the endokinase, the Nebido. We also have in Italy, but not in Greece, but it's also available in other countries like Spain, the propionate, which is a faster extra 48 to 72 hours. The half-life of the enanthate is around 5 days, while cypionate is about a week, while the undecanoate libido is around 10 to 12 weeks. Now, the libido has a disadvantage because you introduce a large amount of testosterone that will spike on estrogens, it will spike on hematocrit, because you introduce 1 gram of testosterone, and it has this great spike that then will have a plateau and will go down, and as you go down, you don't feel good. You don't have the stability of a faster ester. And the advantage of injecting more frequent, like with propionate, is you avoid this spiking. So the perfect TRT protocol is the microdosing, and the ideal microdosing is the cream, because the more frequent you use the DHT, the less the SHBG fluctuates. Now, the transdermal administration, the cream, it gives you more stable levels because you apply every day. And the cream has a very fast metabolism because it clears the system within 1 day. You improve the sex drive because skin has increased concentrations of the 5A reductase inhibitors that increase DHT, and libido is linked also to DHT. It's bioidentical, unlike the synthetic testosterone, which is injectable. And we have, of course, to be very cautious with children and women. But usually testosterone cream is applied either into the scrotum or into the forearms where the skin is very thin. Here we have testosterone injectable, enanthate to the left and cypionate to the right. And here we have 2% gel and 20% liposomal bioidentical cream. Now, we can use also HCG in order to avoid testicular shrinkage and to preserve and maintain fertility. And also there's a claim that if you use DHT, you produce more pregnenolone, progesterone, DHA, the steroid molecules. Now, DHA is another androgen you can introduce into the HRT regimen. You have a better sex drive because as an androgen, it can lower the SHBG. It improves cognitive function, self-esteem, the mood. It can prevent you against the Alzheimer's disease. It improves the body composition, especially in women, and it supports also the adrenal function due to the adrenal fatigue. Mesterolone, which is proviron, is synthetic DHT. It's beneficial because it lowers SHBG, it can liberate more free testosterone. It can also be used as DHT cream. However, we shouldn't use a proviron or DHT cream during prostate cancer because DHT feeds the hyperplasia of the gland. Now, finasteride and dutasteride are the DHT blockers, but they can only work through testosterone. So if somebody uses finasteride, dutasteride for hair thinning, he shouldn't use also mesterolone. He can also use testosterone to block the conversion of DHT, but not taking DHT itself. Okay. Now, about a major subject, if testosterone leads to prostate cancer. According to Professor Morgenthaler of Harvard University, testosterone does not lead in first place to prostatic cancer. Benign prostatic hypertrophy is a good scenario, is something that almost every man after the 80 will develop, and it is actually the low testosterone that makes the prostate gland more vulnerable either to prostatitis or to prostate cancer. How many men are using testosterone worldwide? I guess it's less than 1%. We learned that testosterone cancer develops to the men that have never taken testosterone, which is the 99%. And bodybuilders is the worst example of testosterone abuse. Nevertheless, bodybuilders do not die out of prostate cancer. Low testosterone levels promote visceral fat that releases inflammatory cytokines and also bad estrogens that are responsible for the inflammatory response.
Right. Yeah.
Doctor, the minister, why was support?
So Morgenthaler believes that testosterone protects the prostate from malignancy and prostatitis. DHT is the villain hormone that needs to be blocked, and since it feeds the prostatic hyperplasia. This is why finasteride and dutasteride are used to block the DHT when you have BPH. Another important element is the DIM that comes from broccoli that is able to block the bad estrogens, the estrone, which is responsible for increasing growth in breast and in prostate cancer.
That
Now, what about women and testosterone? Women do not need as much as testosterone, however, it could be part of the HRT regimen along with progesterone and estrogen. Some doctors provide DHEA that will produce indirectly testosterone, but testosterone used in the States for women is getting more acceptance rather than Europe. Nevertheless, testosterone in women can improve sex drive, self-esteem, muscle wasting, and libido. And it can apply as a cream under low concentration, 0.5 or 1% as a cream. And the main adverse is, the main fear is the virilization effects, like voice deepening and hirsutism. We see the decline of testosterone after the age of 30 or 40. And according to a friend, the ultimate goal of TRT medicine is to optimize health and happiness in men. This practically means to create an ideal hormonal environment with elevated testosterone while the system responds if it's not aware of this exogenous supply. This was by John Clisser, the late. That was my presentation, Massimo.
Grazie per essere stato bravissimo a rimanere nei tempi. Volevo aggiungere che in questa presentazione c'è questo aspetto molto importante, se l'avete colto, che tende ormai a sfatare il mito testosterone e cancro alla prostata, ok? Nel senso che eventualmente, proprio ormai sono studi che identificano che anzi il cancro più aggressivo si sviluppa semmai in quegli uomini che hanno livelli di testosterone particolarmente basso. E tra l'altro si sviluppa nell'anziano che tendenzialmente ha il testosterone più basso, non nel giovane che ha il testosterone più alto. E ha fatto giustamente il punto sull'effetto proliferativo degli estrogeni, che sono gli ormoni proliferativi per eccellenza, quando ovviamente in eccesso. E la prostata, l'embriogenesi della prostata, è lo stesso dei tessuti, del seno, delle ovaie, dell'utero. Quindi sono ormonosensibili agli estrogeni. E nell'anziano quello che avviene spesso è che si abbassa il testosterone perché c'è un aumento dell'aromatizzazione, dell'aromatasi, che aumenta sia solo per l'aging ma anche per l'aumento del grasso, soprattutto del grasso viscerale, che avviene quasi sempre praticamente nell'anziano. Quindi quello è il target, semmai, la modulazione, non tanto il testosterone in sé, ma la modulazione dei suoi metaboliti, che sono gli estrogeni, prevalentemente cancerogeni, il DHT forse più responsabile dell'ipertrofia prostatica. Quindi questa modulazione può avvenire tramite anche nutraceutici, abbiamo accennato allo zinco, accennato al DIM, l'estratto di melograno, altri, anche farmaci, ma questo oggi anche la maggior parte degli urologi un po' più avanzati assolutamente consigliano per migliorare la qualità della vita anche la terapia sostitutiva ormonale con soggetti che hanno già subito l'operazione per il cancro alla prostata. Questo è lo stato dell'arte attuale. Se poi vogliamo rimanere ancorati ancora a credenze antiche come quelle che le uova fanno male al fegato o che alzano il colesterolo e fanno male al cuore, bene, facciamolo pure, però questa è la realtà dei fatti.